Did you know that simply changing your sleeping position can reduce heartburn, minimize numb hands, and stop you from waking up sore all over? Keep watching until the end to find out what you should do tonight about your current sleeping posture.
1. Sleeping on your side, the easy default for many people.
The number one issue is choosing a position that allows you to breathe easily and reduces pain without forcing yourself into an awkward posture all night. If you frequently snore, sleeping on your side generally keeps the airway less compressed compared to sleeping on your back, which can quiet the snoring.
If you often get heartburn that burns your throat after dinner, remember the trick of sleeping on your left side, because gravity typically prevents acid from flowing up compared to sleeping on your right side. The misunderstanding and the truth about left versus right is sleeping on your left means your left shoulder is touching the mattress, not your face is turned toward the left side of the screen. A common example is lying on your left side while still looking at your phone placed on the right side of the bed, because your face can turn any direction even if your body is leaning left. Tonight's tip for heartburn is to elevate the head of your bed slightly by putting risers under the bedposts or using a wedge pillow, rather than just stacking pillows under your neck. Tonight's tip for side sleeping is to hug a pillow to your chest to prevent your arm from dangling freely, reducing that pins and needles sensation, like your arm has fallen asleep. The summary for Section 1 is prioritize sleeping on your left side if you suffer from frequent heartburn, and side sleeping generally works well for snorers. However, this is reference information, and if symptoms are severe, you should consult a doctor.
2. Curled up like a fetus. Feels safe, but don't curl up too tightly.
The number 2 issue is that many people like sleeping curled up because it feels secure, but they wake up with neck pain, back pain, or shallow breathing.
If you curl up tightly like a compressed ball, your neck is bent and your chest is squeezed, making you prone to shallow breathing, feeling like you're struggling for air even while asleep.
A common example is waking up with a stiff neck, as if you'd been staring down at your phone all night, even though you were just hugging a pillow.
The misunderstanding and the truth about the fetal position is the posture isn't bad. The bad part is being too tight. Tonight's tip is to turn that tight curl into a loose curl by straightening your legs a bit so your hips aren't so flexed.
Tonight's tip number 2 is to place a pillow between your knees to keep your hips aligned, reducing hip pain and lower back pain. If you are pregnant or have a large abdomen making it hard to turn over, comfortable side sleeping is usually a lifesaver rather than trying to force yourself to sleep on your back. The summary for Section 2 is keep using the fetal position if you like it, but curl loosely and use supportive pillows. This is reference information, and if pain persists, you should seek medical attention.
3. On your side straight out with arm extended. Comfort comes at a cost to your shoulder and arm. The number 3 issue is that side sleeping helps with many things, but often trades that for shoulder pain or arm numbness. When you put all your weight on one shoulder all night, that shoulder is like a compressed table, and blood flow and nerves can be pinched, causing tingling. A common example is waking up with such numb hands that you drop your toothbrush, making you wonder, who was sleeping on my arm?
If you frequently suffer from shoulder pain when side sleeping, change your strategy. Slightly open your chest by hugging a pillow to prevent the bottom shoulder from getting trapped.
Tonight's tip number 1 is to choose a pillow high enough that your neck isn't bent downwards, because a bent neck stretches the shoulder and causes secondary shoulder pain. Tonight's tip number 2 is to try side sleeping, but place the bottom arm out in front of your chest. Don't tuck your hand under your head like an extra pillow, as this makes numbness more likely.
The misunderstanding and the truth about extending your arm is stretching your arm might feel comfortable when falling asleep, but if you do it too long, you end up straining the neck and shoulder area.
The summary for section 3 is side sleeping is good, but your shoulders and arms need to be positioned correctly, and if pain and numbness are frequent, you should consult a doctor to be sure.
4. On your back. Straight spine, but often becomes a snoring machine.
The number 4 issue is that sleeping on your back helps straighten the spine, but many people fear snoring and sleep apnea. Back sleeping typically keeps the neck and back in a neutral position, which often provides relief for those with back pain.
But back sleeping also makes it easier for the tongue and soft tissue to fall backward, which increases snoring and can be more dangerous for people suffering from sleep apnea.
A common example is sleeping on your back with your mouth open, waking up with a throat dry as a desert, and your family telling you sounded like a chainsaw last night. If you suspect sleep apnea because you are frequently tired during the day, wake up with headaches, or family members observe you stopping breathing, this is the time to see a doctor, not to try unverified remedies yourself.
Tonight's safe tip for frequent snorers is to first try side sleeping or wedge pillows behind your back to prevent you from rolling completely onto your back.
While there is a common suggestion about sewing a tennis ball into the back of your shirt to force yourself to turn on your side, if you have pre-existing health conditions or suspect sleep apnea, you should ask your doctor before trying it.
Regarding mouth taping, if you have a stuffy nose, severe snoring, or suspect sleep apnea, you should not attempt it yourself due to risks, and should consult a doctor for safety.
The summary for section 4 is back sleeping is good for the back, but it's not suitable for everyone's airway. Prioritize safety and consult a doctor if you notice unusual symptoms.
5. Sleeping on your stomach reduces snoring, but the neck takes the hit.
The number 5 issue is that many people can only sleep on their stomach, but this leads to neck pain, lower back pain, and pillow creases on the face. To breathe while stomach sleeping, you have to turn your neck nearly 90 degrees, meaning your neck is severely twisted for hours on end.
A common example is waking up with such neck pain that when you turn to look at the clock, you feel a crunching or popping sound inside. The misunderstanding and the truth about stomach sleeping is you cannot look at a posture and determine someone's personality or past, because habits, temperature, and feelings of security also influence how we sleep.
If you sleep on your stomach because of snoring, it's true that many people snore less because gravity pulls the tongue forward, but the price is usually paid by the neck and back. Tonight's tip number 1 for stomach sleepers is to reduce your pillow height, or even try removing the head pillow so your neck is bent less to the side.
Tonight's tip number 2 is to place a thin pillow under your chest or hips to prevent your lower back from arching like a bridge. If you worry about facial creases when side or stomach sleeping, a silk pillowcase can help reduce friction, but don't expect it to replace proper posture and pillows. The summary for section 5 is stomach sleeping may reduce snoring, but treat it as a last resort and prioritize protecting your neck. This is reference information, and if pain persists, you should seek medical attention.
6. Rolling around like a washing machine, normal or a warning sign.
The number 6 issue is that many people say they sleep in every direction, accompanied by leg twitching, constant turning, or waking up feeling exhausted, as if they haven't slept at all. The truth is that changing positions is sometimes normal, as the body instinctively seeks a position to relieve pain or prevent suffocation. But if you roll around a lot alongside numb hands, shoulder pain, heartburn, or daytime sleepiness, that's when you need to review your habits and consider seeing a doctor.
A common example is side sleeping, where your legs keep twitching like you're kicking a soccer ball in your dream, and you wake up to sheets looking like a wrestling match occurred.
Tonight's tip number 1 is to cut off coffee and strong tea at least 6 hours before bedtime, as many people experience more severe leg twitching when consuming stimulants late. Tonight's tip number 2 is to take a warm shower, stretch your calves for 2 minutes, and then use pillows wedged on both sides of your hips to keep your body from rolling. If you are using a breathing assistance device like a CPAP or BiPAP, a machine that blows air to keep the airway open, you should consult your doctor to adjust the mask and posture accordingly, as self-diagnosing can easily lead to mistakes.
The summary for Section 6 is minor rolling is normal. However, excessive rolling accompanied by fatigue and symptoms should be handled cautiously, and a doctor should be consulted if necessary.
7. Quick conclusion and your options.
Choose one main goal, reducing heartburn, minimizing snoring, or alleviating back pain, and then select the appropriate posture based on that goal. Remember the principle that the pillow is there to support your neck, and the mattress is there to support your body. Your neck shouldn't carry all the load. Leave a comment below letting us know if you're on team side, back, or stomach, and where you hurt the most so we can create follow-up content based on your needs.
Make sure you subscribe to the channel so you don't miss our easy-to-apply, straightforward, honest, and easy-to-understand tips. And a gentle reminder one last time, this is for reference only. If you have abnormal signs, severe or persistent symptoms, you should seek medical attention and consult a physician to be certain. Goodbye, and see you in the next video.